Good morning. This is Dawn Miller with the Division of Behavioral Health and Recovery. Welcome to the webinar. We're not quite ready to start. We're going to allow other attendees to log in, so we'll be with you in just a couple of minutes. Good morning to those of you that have logged on. We're going to start the presentation in a couple of minutes. All right. To be respectful of everybody's time, I think we'll go ahead and get started. I see that 33 people have logged on, 35 actually at this point in time already. This morning is the Topical Employment Webinar sponsored by the Division of Behavioral Health and Recovery. And we have the good fortune of having Felicia Talbot, who is going to be speaking to us this morning related to basic food employment and training. As we talk, if you have questions, you can raise your hand, type them in the chat box, and I will keep Felicia informed as far as who's asking questions. Welcome to the webinar this morning. It is being recorded, and I know there have been individuals that said they would like to be able to view the recording after the fact. I will send out the recording within a week or two after the training. I'm going to double check. Can everybody hear me? And you can either raise your hand or put in the chat box if there are any kind of issues. Having said that, I'm not seeing anything yet, so I'm hoping folks can hear me. All right, we're going to go ahead and get started. Felicia, I'm turning it over to you.
Good morning, everyone. Thank you for having me and giving me the opportunity to share some information about our BFET program, the Basic Food Employment and Training. We are a volunteer program here in Washington that is working towards working with SNAP recipients. And if you want to go to the next slide, our program is a group of agencies that deliver services to SNAP recipients. And so our division, Community Service Division, we contract with community partners that provide the actual employment or education or both and training services. Of course, our goal is to assist food recipients in obtaining skills, work experience, and or refreshing their existing skills towards finding jobs that have a livable wage, moving them towards self-sufficiency and less reliance on public assistance. And that goal of BFET, our program, it aligns with our division's work towards reducing poverty in Washington. Our BFET program started as a pilot in the Seattle area in October of 2005. So there was some federal funds available to start up an employment and training program. And it is a reimbursable program, a 50-50% reimbursable program. So when that pilot began, there was a handful of 5 providers, a couple of state 2-year colleges, and a couple of community partners who went out and found some funding, state and city, non-federal funding, that they could match 50% with the money that BFET provided. So at that time, they also started talking with some of the tribes in Washington, and tribes are able to run a BFET program at 25% reimbursement. So that means, so what does this reimbursement program mean? They're third-party contracts. They find their state and city match or county or possibly private foundation funds, and they spend the funds 100%. They spend the funds on their BFET program, and then they ask for reimbursement from our program. So let's see, next slide. So how do our partners deliver BFET? So our partners, usually they already are delivering services in the community and have a variety of programs. And so BFET relies on those community partners to use the BFET funding to enhance their existing programs. They oftentimes enroll, so an agency might have a housing program, they might have some sort of employment prep program, and with their BFET program, they could have clients or participants that are kind of co-enrolled, and we can talk about that a little bit more later. But our community partners are out there already serving clients, already possibly likely serving SNAP recipients. And so BFET is just another way for them to enhance their existing services and again, serve clients that might have multiple barriers or different goals, all related to working towards employment. And the BFET model also serves to help agencies that might be growing, and just in terms of their service delivery. We currently work with all 34 of the 2-year state colleges, and we work with the State Board of Community and Technical Colleges, and they, of course, in turn then work with the 34 colleges. We currently work with 45 community-based organizations in at least 30 of the counties, and it kind of expands. So we have some agencies, community-based organizations they're located in King County, their main office, but they might have satellite offices in other parts of the state. And we, this is, since BFET is a volunteer program. We are continuously accepting letters of interest and all around the state, really. And so agencies hear about our program, are interested, they can reach out to us, and we will then look at where our existing providers are and where's the need. Different parts of the state that are underserved by BFET services, whether it's education at the colleges or if it's community-based organizations. So we're very deliberate in, as we grow our program, where we are trying to continue to partner with more agencies. Next slide. So I want to talk a little bit about who is eligible for BFET and also how they access services. So we have these basic requirements. Participants should be receiving basic food benefits, and that would be the federal SNAP. They should be, oh, maybe go back one slide. They should be able to work 20 hours per week. So we're talking about a participant who is ready to work. They may not be working 20 hours a week, but would be able to if they were able to find employment. They should be 16 years old, not receiving TANF, and non-TANF recipients. That means so a relative who might be caring for a relative child on TANF that, let's say an auntie and uncle are caring for a niece, if they are not the actual recipients of TANF and they're also on food, they may be eligible for BFET. And we actually dig deep into cases and take a look at that. And then really the participant has to be ready to engage in the activities related to job preparation and job search. So those are the basic requirements for the BFET program. And so how do clients access BFET? So again, I've said it's voluntary. It's a voluntary program. And so there's a variety of ways. Because it's voluntary, we have participants who walk into community-based organizations looking for help. And they may not be aware of BFET necessarily. They are walking in maybe they're looking for help finding housing or just help finding a job. Our agencies that we contract with generally, as I said, to have multiple programs to assist people in the community. So a lot of our agencies have their own kind of screening tool. They're checking to find out, is a client receiving food? Are they on TANF? Are they participating in another program? And basically conduct an assessment. What services are they looking for? And that would include what are their employment goals. And so they're trying to determine, are they a good fit for the BFET program or any other programs they have. So a participant can walk through the door of an agency and find out about BFET. Participants also find out about BFET in our community service offices. So they might be applying for food assistance, or they might be attending a review of their existing basic food. And our financial workers have access to the BFET brochure. It shows they're broken down by the regions, the 3 regions of the state. So we have one, they're geographic brochures, and it lists the contracted providers BFET with a phone number. And the colleges, a client could walk into a college program. They're enrolling for college. in most of the two-year colleges, they have orientations, financial aid kind of orientations, and workforce education departments hold these orientations that participants go to, and they might also have some sort of screening, find out information about the participant and if they might qualify for the college's BFET program. Of course, participants might have heard of BFET from a friend or family member or just through word of mouth and could walk into any of the above, the agencies, into the community service office or the college, and ask about BFET. And then we have a website at the end of the slideshow is our public website address. Clients can go there, and there's actually a section for them to click if they're interested in finding out more information, and the link takes them to a list of the BFET providers. And we are continuously and always trying to update that website at least yearly, so we can add any new providers and also make it user-friendly, so that when a potential participant is looking at that website, that it really helps them find providers in the area or the information that they're looking for. So let's see, next slide. So the next slide talks about support services, but support services is just one part of the case management in the BFET program. And what does our case management look like in BFET? Of course, every agency runs their own BFET program. However, for our program requirements, they must have at least one contact per month with the client. Oftentimes they're seeing them multiple times throughout the month, or maybe once a week, depending on what activities the client is that they're participating in. So, and oftentimes participants they're participating in more than one program in an agency. They might, and so we tend to see BFET cases documented that show the co-enrollment or that the client is receiving multiple services, including BFET. And we have, as part of our BFET program, our colleges oftentimes and our community-based organizations co-enroll BFET services with each other, working with the same client. So they might be attending classes at the local community college, and then as they finish their certification or their degree, they're moving, maybe it's the last quarter or two, and they're moving towards preparing for job search. And so our college BFET program may reach out to the local community-based organization that is working more with job skills training and job search training and job search activities. And so we oftentimes see students in both BFET programs, and we have mechanisms in place to ensure, and our contractors, of course, work together very closely to make sure that there's no duplication of services. However, utilizing both programs to the best to serve the student that's then moving into job search. And our BFET partners, whether it's the college or community-based organizations, excuse me, we also work with other programs, their other community partners. And in regards to our case management, we also see that other ways and other resources that are leveraged to serve BFET participants. So while students are in school or a participant is in job search or in job training, whether it's basic education, vocational education, maybe they're in a welder's kind of a refresh welder's course, or whether they're in adult basic education classes. BFET, each agency is able to provide a variety of support services. The slide shows some of them. Not every agency has their own contract, and depending on the location and the services, the components that they might, the BFET activities that they're delivering or co-enrolling with, the agencies identify which support services that they're going to provide. Transportation is probably the largest support service. We see everything from bus passes and bus tickets to train, light rail, a variety, and it's based on support. The support services are based on what's necessary and reasonable. So how can the agency support that client, that participant getting to their activities? Work-related clothing, that includes interview clothing, housing and utility. There are some limitations on that because it's not, BFET of course is, we have the FNS, the Food Nutrition Service guidance regarding all support services. And so in Washington, our BFET program might be able to help with kind of an emergency housing, like with clients who might be facing eviction, and our providers look at their budget, and if they are able to assist with preventing that. Preventing an eviction or helping someone get started could be that vital point that keeps them engaged and allows them to engage in their job search activities, or if they're in school. Child care subsidy is actually, BFET is an approved activity for participants to then access our child care program. And of course, they have to meet child care requirements. However, most of our providers work really closely with clients, participants that have children that need child care. And we do our best on our end to make a smooth process to accessing child care. Personal hygiene and grooming, that can be a variety of things. School supplies, and then certification fees, that could be helping someone pay for their LPN nursing test fee. Also, we help with assisting with driver's license, folks that need abstract. So there's a variety of different licensing and certification fees that BFET might be able to help out with. And finally, tools and equipment needed to secure employment. Those are again, it's the basic, is it reasonable, and is it something that's going to help towards securing and maintaining employment? These support services are available during the course of case management and also during retention services when a participant has obtained employment, and for 90 days our program is able to assist them in retaining that employment. So it's a best practice of our providers. They leverage any other support services in the community, and again, look at the need and if it's reasonable, excuse me, and necessary. And that kind of determines support services. We in the ENT world, our contractors, our providers determine in through their budget all of these services. And allowable services, we share with them. We have a handbook for our BFET providers, and we have a directory that's based on guidance from FNS. And we generally, our providers utilize those tools to determine all these, what they can provide, and then they reach out to us in policy and program to find out if there are any exceptions. And so we look at those case by case. And so let's see. That's it.
Felicia?
Yes.
I do see a question, and wanted to know if you wanted me to share it with you now or later.
Sure.
Pam had said, I have a client who is in the Avista Lineman School, working at Salvation Army Warming Center on BFET, needing to take the OSHA 10 certification. Can BFET pay for that certification?
Sure. So what we would, the BFET worker would look, whoever the case manager is for the participant, they would need to look at our BFET directory. And if they don't find OSHA specifically listed, or if they don't find it, that case manager actually reaches out to the team I work on, and we review the case and give a case-by-case approval. So it could be that BFET could help with that. Basically, the case manager would look at any internal, whatever organization they work for, kind of their BFET support service protocol, and then and our requirements. So I would encourage the participant to ask their BFET case manager if it's something that BFET could help with. Does that help?
It said, she said, great, thank you.
Okay. Yeah, and I just do want to note, the different agencies all have different contracts, and again, you know, we might find an agency in a rural area where there isn't much public transportation. They'll have transportation in their budget, but maybe they focus on other things. Each agency really truly is different, so there isn't like cookie cutter support service amounts like across the board. It's every contract, and it's always best if the participant, you know, reaches out to their BFET case manager and inquires. So, are there any other questions kind of about case management or support services? No? Okay. So we can move to the next slide. And so this is a slide from earlier this year. This is the state, and it might be better if you're looking, if you can see, they're tiny. This basically breaks out the state. The red dots in the counties are where the state colleges are located. And again, there's 34. The green dots represent our community-based organizations. The yellow dots are in, it looks like 4 counties, and that's our ARIA. So BFET has a program that also serves refugees and immigrants, and they have their own eligibility criteria. And so when a person is screened in the process within our system, and the case manager is checking our system to see if a client is eligible for BFET. It also tells them if they're an ARIA, if they're ARIA eligible. So we have 12 ARIA agencies in those counties, and that's what the yellow dots represent. The blue dots are representative of a remote location or an additional location. So an agency that's located in King County actually has offices in Whatcom, Skagit, and Snohomish. And then finally, we have purple dots in 4 counties that the RISE pilot was located in. And the RISE pilot was a 3-year pilot that just ended in December of 2018. So a lot of, probably at least half, if not more, of our ARIA providers also provide mainstream BFET services. And in 3 counties of the RISE pilot, most of the providers were already BFET and they signed on to our pilot. So this map gets updated once a year. It's on our website, and this just gives you an idea of kind of where services are. The areas that only have one little dot and the number is low, like in Okanagan, we have 2 providers. That's an area, I mean, we're always looking in the underserved areas of Washington for new partners. Next slide. So our BFET program outcomes. So we measure participant activities to show the outcomes of BFET. We follow a cohort, a couple different cohorts over the years, and we cross-match with UI data, with employment security wage data, and that allows us to kind of have an idea when someone exits the BFET program, if they're still employed, and what their wages are. And we utilize that data to try and follow the outcomes, follow their employment past BFET, to then kind of predict how our program's doing. We run reports. All of our case management for BFET is entered into our EJAZ system, and BFET has its own section of EJAZ. And so we run component reports. And when I say component, I mean things like, are they in job search? There's a component specifically for job search. Vocational education, and we can drill down to, is it a college vocational education program, or are they with a community-based organization that has a vocational education? And so we run those kind of reports based on if it's a school or if it's a community-based organization, and then as a whole. And we look at a length of time that participants are in those activities, and kind of connecting the dots. Were they in training? Were they in education? Was it basic education? Was it vocational? And so we look at all of those factors. We also review case notes, so that program monthly requirement of 1 note at a minimum that tells the participant's story in BFET. We review those. We have seen that reviews case notes, and they're not just looking, was a case note made, they're reading it for content. We have some elements that we require, and it's all connected to telling the story. And then we look at those components, and we look at if we use the components and notes to also look at co-enrollment of a student at a college, and also with a community-based organization, and what does that look like? And so we, of course, report out to Food and Nutrition Services, who are our funder. They're part of the USDA. And but we also provide outcome information with our providers in a variety of ways. We have quarterly reports we send them so they can kind of track their own participants and wage data, and it's a delayed, but we still are providing it. Gives them an idea of kind of their actual program outcomes. And we also provide quarterly reports to our providers from our system. They can run their own reports, but we put a quarterly together, and that's also how we track performance with our contracts and outcomes. Next slide. So how do we support our providers? So we are continuously improving our BFET program across the state. Washington Washington State's BFET program is a national model. The Food and Nutrition Services look to our state and our BFET program for other states that are, most states have some sort of employment and training program that's funded through FNS. However, states are at different places in growing those programs. And so Washington, we often, a few times a year, we have different states visiting us. And some of the things we share with new states or states that are enhancing their program are some of the things that we do to support our providers. So we have a handbook that's on our website. If you go to our website later after the webinar, and you'll find basic information on BFET, but there's also a provider resource tab. And when you go to that, we have our handbook, we have our support service guide. It's called Participant Reimbursement Directory, and also desk aids and tools for our providers to make their program successful. So we have a handbook that gives guidance, and we onboard new providers. We go out and spend at least half a day with them going over all of the ins and outs of the contract and the handbook to get them started. We provide technical assistance to our providers to start working in EJAS, where all of the case management information is, notes about progress, the actual components of activities. And we provide ongoing technical assistance for case managers and providers. We have two parts to our team. So this coaching and supporting of the BFET providers comes from program and policy. That's the team I work on. And we look at policy questions, those exceptions to spend more than what's allowed on a support service. We might review a case that a participant's already used the maximum housing, and now something has changed and it's 6 months later, and those exceptions we look at. And we refer to the contract and the handbook for any type of service delivery policy question. We have another team that is our operations team, and they're located throughout the state. I believe there's at least 12, and there are a few in King County, but then Spokane, Longview, Kelso, and the operations team, they're the ones that go out and actually, if a case manager calls and says, I've been on board with this agency for 3 months, we've got our caseload going, and they're looking for best practices, or they just need more EJAS training. Maybe they're receiving a case note audit that's, there's some issues with their case notes. Our operations team will go out and work and provide that technical assistance, show providers how to use the EJAS reports, the reports that we have in the system that any of our providers can run. And then we also provide training. Our fiscal provides training. They have monthly WebExes for providers, whoever works on their billing, their invoicing for reimbursement. Our fiscal conducts a monthly kind of ongoing, what do providers need from us, and share that information. So we approve eligibility. So that's BFET eligibility. So that's and we train our providers. They can use EJAS to check eligibility themselves. And then there's also a mechanism if there's a problem with that, and they're saying they use EJAS to check, is this client eligible for BFET, and they get a denial. But the client is saying, but I'm on food, and I don't know why I'm being denied. We have a mechanism for providers to reach out to our operations team, and there's a process. then the operations team can go take a look at that client's food case, or to find out what might be preventing, what's the denial reason, and then they get back to the provider. And providers have a billing mechanism, and so we provide training on all of this so that they can bill us monthly or quarterly, however they've set it up in their contract. Quality control. So I kind of talked about that a little bit, but our operations team looks at the provider, their caseloads, and they review the notes. They have monthly note audits, and it's a tool, so it's not like a monitoring. We're not monitoring them like for the contract. It's just a monthly peek at their caseload. How are they doing on the case notes? Are they telling the story? And that helps them grow and make their program stronger, giving them feedback on their case notation and telling the story. And our operations team works with state board. There are 34 colleges, and every college even has, different programs that their BFET program might fund. And so we have a relationship in our with state board, and our operations team works with them, and they go out and work with colleges, or they work with state board to deliver training to their colleges. And then community engagement. So we have we have a team for ABODs, which are the able-bodied without dependence food recipients, and they have requirements to participate, to work. They have requirements to continue receiving food. So we have events. Our ABOD team that works with the participants, with the clients that have those requirements. Our ABOD team holds community, employer, and BFET kind of events. Right now, it's in King County that we have food recipients with requirements in King County, with the exception of the Muckleshoot Reservation. But all other SNAP recipients outside of that have requirements. And so our ABOD team holds events trying to connect those folks with either a BFET program, which would be considered an approved activity, and working towards the goal of employment. And we also engage our providers. We have a series of meetings. We have a quarterly meeting with providers, and it's statewide. We have a big WebEx meeting, and our operations staff hosts for providers to go to the counties or locations where they are. So we usually have at least maybe 6 to 8 locations around the state. Our BFET providers go there or log into the WebEx, and we have a quarterly program meeting. And we have all aspects of fiscals there. So we try to support with updates in quarterly meetings. And we have a yearly training forum. And at that time, we are providing requested training to our providers. We provide kind of innovative, moving forward, how are we improving our BFET program, and sharing ideas and success stories with from different agencies, or panel discussions, things that will help BFET providers enhance their program. And then throughout the year, we provide some training. And we provide like WebEx trainings, and providers, if it's something that they're working on or want to enhance in their agency. So we continuously are trying to grow our program and also support the growth within the agencies that we work with. And as employment and training grows nationally, the spotlight on existing programs grows, but also food and nutrition services, as employment training grows, they're looking more and more at programs and what's working and what's not working. So we take the opportunity at our training forums and any training that we provide to have that focus on improving programs. So let's see, the next slide is really resource and contact information. It has our public website, and feel free to go to that website. There's a whole section for clients, potential clients, and then there's a section for provider resources. A lot of information there about our program, and then we have a policy email that's up there, and our policy team fields questions from providers, and/or occasionally we might hear from an agency that we don't necessarily partner with in BFET, but they send in questions. But you could reach out to us if you had further questions. If you know of an agency or you are that's interested in BFET, there's a whole section on our website, and people could reach out to us there. So that, if there are any questions on any of the information, I definitely have time to answer any questions about BFET.
And I will mention it again, this is Dawn, that you can either raise your hand or type in the chat box. If you raise your hand, I should be able to unmute you if you want to ask a question verbally. I do see one, Felicia, that says, as a potential CBO, what services do we provide to participants to find employment? Is it one-on-one job development?
Okay, so actually, as a potential agency, we have an interested partner packet, and it kind of talks real kind of high level about different job activities, but an agency actually tells us what they want to do for their job search. So we have agencies that, the case manager does work with the client, the participant, on some job search prep, but that agency might have a class that they offer once a week on kind of like a job lab or a job search lab kind of setup. That's kind of drop in, and maybe your agency might include that as part of your job search activities. You might fine tune it specifically to every client because they would have different needs. We have agencies that say that they're going to deliver job search training, and they look at our definition and some of the things that could be job search training. And when you contract with us, we ask you if you're going to choose to deliver job search services. We ask you how many clients do you think you're going to serve and the budget, but we also ask you, like, can you define what your job search includes? An agency that has a welder's kind of a refresher welder's course that's like 3 weeks long or 6 weeks long, that someone might take before they recertify. They haven't certified or for 6 or 7 years, they've been long-term unemployed. They would define in their contract what their vocational education, their VE component might include, and they might say welder's 6-week course. So some of it is one-on-one with clients in, like, say, job search, but some of it also is they might go to classes. Clients can complete job search activities on their own. We have a job log. We have some requirements around job search. So I hope that answers your question. Your agency defines what you're going to do for each component.
And I do see another question that says, is it possible to print out the slideshow to share with my coworker? I will be sending out the slides along with the link to the video or the recording when available to me. So anyone that has registered for the training will actually get that email with the slideshow and then the link to the recording. See another question that says, to refer someone to this program, would we contact a specific community organization / college?
Yes, you could refer. So because it's voluntary, and I mean, if the client has found an agency or you've identified an agency, you want them to reach out to YWCA in King County. It's located where the client can get to. You've checked it out. It might sound like it's a BFET program that they're interested in. The client can call. You can help them call. The client can walk in and ask for the BFET program, and that agency would then point them in the right direction, set up appointment, however they start out with like an intake or assessment. So clients can self-refer, or you can help them. You can help them reach that agency.
All right. Once again, if there are other questions, you can either raise your hand or type into the chat box, whatever works best for you. We've answered the questions up to this point in time. Anyone else have any other questions? I'm kind of scrolling through the list of attendees to see if I see any additional questions. Looks as though we have answered those that there are at this point in time. So any parting thoughts then, Felicia? And I think if there are no other questions, we'll go ahead and end early. So other parting thoughts?
No, just feel free to reach out to us. If you're a potential agency, you can reach out to SWBFET Policy email and send us an email. We can send you more information, or check out our website for agencies, and you can reach out to them directly. Or if you have any questions that you think of after this ends, feel free to reach out to SWBFET Policy. We'd be more than happy to talk. And I hope this has been helpful.
And I do see that one of the participants said very informative. So yes, indeed, and I would agree. Thank you so very much, Felicia, for being willing to be with us today. The information.
Sure. Thank you for having me.
Absolutely. And thank you all for attending. We will get the recording and the slides out to you as soon as is possible. And kind of bookmark in your calendar for next month. Our next presentation will be on, let me get the right month, May 16th. I hope you have a wonderful day, and we'll talk to you later. Thank you very much. Bye-bye.